Dr. Baliga here. This podcast is a multiple choice question preparation for the boards from an outstanding chapter titled Perioperative Medicine in Baliga's textbook of internal medicine, available at mastermedfacts.com. The chapter is authored by Dr. Hugo Quinny Cheng, MD, who is professor of medicine at UCSF. He also completed his medical school and residency training there. He works as a hospitalist with a clinical focus on perioperative medicine. He also directs the Internal Medicine Board Certification and Recertification Review CME course for UCSF's Department of Medicine. A 63-year-old woman with coronary artery disease and congestive heart failure is undergoing preoperative medical evaluation prior to elective craniotomy for meningioma resection. She underwent placement of a sirolimus-eluting coronary artery stent 9 months ago. Since then, she has not had chest pain, dyspnea, palpitations, or syncope. She can walk 4 blocks. Her medications include carvedilol, losartan, aspirin, clopidogrel, and lovastatin. Cardiac exam shows a 3/6 systolic murmur at the right upper sternal border. She has no jugular venous distension, crackles, or peripheral edema. EKG shows a right bundle branch block and left anterior fascicular block. A recent echocardiogram showed moderate aortic stenosis and normal left ventricular ejection fraction. The surgeon states that antiplatelet agents will need to be held for operation. Which of the following actions is most appropriate? A. Refer the patient for placement of a permanent pacemaker. B. Give the green light for the surgery since it's over 6 months after stent placement. C. Refer for repair of or replacement of aortic valve. D. Start furosemide. And E. Start digoxin. And the answer is B. The management of cardiac disease in surgical patients generally mirrors that of non-surgical patient. This patient does not have independent indication for either pacemaker placement or aortic valve correction and should not undergo these procedures simply because of an upcoming non-cardiac operation. There is no indication to start furosemide given the absence of volume overload. There is also no indication for digoxin either in the absence of atrial fibrillation or systolic dysfunction. Patients with drug-eluting stents should be maintained on dual antiplatelet therapy for at least 6 months. Elective surgery that would require stopping antiplatelet agents should be postponed during this time. This short case scenario is from an outstanding chapter titled Perioperative Medicine in Baliga's textbook of internal medicine, available at mastermedfacts.com. The chapter is authored by Dr. Hugo Quinny Cheng, MD, who is professor of medicine at the University of California, San Francisco, where he also completed his medical school and residency training. He works as a hospitalist with a clinical focus on perioperative medicine. He directs the medical consultation service and co-management with neurosurgery service and regularly teaches about preoperative medical evaluation, perioperative medicine to residents and practicing physicians. He also directs the Internal Medicine Board Certification and Recertification Review CME course for UCSF's Department of Medicine.